Now comes the most important part, which is about the muscular attachments. I already told you that there are some important muscles which have got their origin or insertions on the clavicle. So let's study the muscular attachments. So you have got the superior surface and you've got the inferior surface. I'm not going to repeat the important bony structures, but you can see this is sternal and the acromial end. Then you have the conoid tubercle. Then this is the body of the clavicle. Okay, and then you have the this is the convexity, which is backward, and on the medial end, and concavity, which is forward, and on the lateral end. So this is the medial 2/3 and a lateral 1/3 of the clavicle. Then you have the other surfaces. One is the anterior surface and one is the posterior surface. The surface which is facing forward towards you, that's the anterior surface, and the surface which is backward, that's called as the posterior surface. So that would be the anterior surface, you can see, and the backward surface is called as the posterior surface of the clavicle. Now, when you are talking about the muscular attachments, remember there are two important things. One is the origin of the muscle, and the other one is the insertion of a muscle. So origin is the one from where the muscles originate, and the insertion is the one where the muscle attaches at the distal end. So you can say origin is a proximal part, and the muscle insertion is the distal part of the attachment. Okay, so when you talk about the important muscles, you have the sternocleidomastoid. So you can see I have labeled the muscular origins as red, and the blue marking in your screen would show you about the muscle insertion, and the ligament attachments would be in the green color. Okay, so this is the sternocleidomastoid muscle. Its origin is at the medial end of the clavicle or the sternal end of the clavicle. I'm not going to go into the details of the functions of the muscles. We'll be discussing it entirely in a different lecture. But remember, sternocleidomastoid is the muscle which, when you move your neck on the right side or you move your neck on the left side, then there's a muscle which contracts here. So this is the sternocleidomastoid muscle, and its origin is from the medial end of the clavicle. Then you have the pectoralis major muscle. So the pectoralis major muscle is the muscle which is making up the front part of the chest. Okay, it's a kind of a muscle which protects the breast tissue in the female or a male body as well. But most commonly, this pectoralis major muscle, it has got its insertion, its origin in onto the inferior surface of the clavicle. So this is the inferior surface of the clavicle. So the origin of the pectoralis major is from the inferior surface of the clavicle, but at the medial end. Then you have the deltoid muscle. So the deltoid is getting its origin from the lateral part of the clavicle. So you can see the inferior, but the lateral part of the clavicle. Then you have a trapezius muscle. Trapezius is a muscle of the back and responsible for the shrugging of the shoulder, like when you lift up your muscles like this. Okay, so this is the shrugging of the shoulder. So trapezius has got its insertion on this superior but lateral part over the conoid tubercle, and the deltoid, which is responsible for the abduction of the arm. So this deltoid has got its origin to the inferior surface of the clavicle. Okay, so this is another view, which is the inferior view. So you can see actually more precisely here, you have the pectoralis major muscle, and the pectoralis major muscle is again important muscle of the chest wall, and it's the origin of the muscle is to the inferior surface of the clavicle. Then you have the sternohyoid muscle. Sternohyoid is the strap muscle of the neck. I'm not going to go into the detail of the strap muscles of the neck. We will be discussing it in some other lecture. But this sternohyoid muscle is a strap neck muscle, and it's attaching to the inferior surface of the or you can say the origin of the sternohyoid muscle is to the inferior surface of the clavicle. Then you have a subclavius muscle. Subclavius is an important muscle, and it has got its insertion over the you can say the medial part, or you can say the middle part of the clavicle. Okay, so this is actually the middle part of the clavicle, and it's on the the posterior and the inferior surface. Okay, then you have the deltoid. Already talked about the deltoid. It attaches, or it gets its origin from the lateral part of the clavicle, and deltoid is a muscle responsible for the abduction of the arm. Now, there are some important ligaments. I already talked about these ligaments. So we have the acromioclavicular ligament, you have the sternoclavicular ligament, you have the coracoclavicular ligament, and you have the costoclavicular ligament. Okay, so the costoclavicular ligament attaches to the medial part of the clavicle inferiorly, okay, posterior inferiorly. And this costoclavicular ligament is responsible for the attachment of the clavicle with the first costal cartilage. Then you have the coracoclavicular ligament, which is the coronoid ligament and a trapezoid ligament. They're divided into two. So one is a trapezoid ligament and the other is a coronoid ligament. So they're the coracoclavicular ligaments, which are attaching the coracoclavicular, or you can say the coracoid process of the scapula to the lateral end of the clavicle. So that's why clavicle is very important bone, because it has got the origin and insertion of different muscles. Like we talk about the pectoralis major muscle, which is a muscle of the chest wall. Then you have the deltoid origin from the lateral part of the clavicle, or you can say the acromion end of the clavicle, and it is responsible for the abduction of the arm, right? Then you have the trapezius muscle, and trapezius is inserted on the clavicle, and trapezius is responsible for the shrugging of the shoulder. Okay, just like that. So and then you have important subclavius muscle and some of the other ligaments like coracoclavicular and costoclavicular ligament, which are attaching to the clavicle. Okay, so you have a better view here on your screen. One is a superior view and the other is inferior view. Okay, so the superior surface, you have the sternocleidomastoid, you have the deltoid, the origin of the sternocleidomastoid, the origin of the deltoid, and the insertion of the trapezius muscle. Okay, and on the inferior surface, but posterior view, you can see you have the pec major, sternohyoid, subclavius, then you have the different coracoclavicular ligament. So remember, the attachments are very important because whenever, the clinical implication of this is that if there is a fracture of the middle third of the clavicle, so the sternocleidomastoid is actually attaching to the medial end. So what will happen? That the medial end would be pulled upward by the attachment of the sternocleidomastoid muscle. So let's suppose this is the medial third, okay? And on the medial end, let's suppose this is the medial end and this is the lateral end. So what will happen? That at the medial end, there's a sternocleidomastoid muscle is attaching, and when there's a break in the continuity of the clavicle, it would be like this, right? So the lateral end would be droop inside, and the medial end would be upward, pushed upward, pulled upward by the sternocleidomastoid, and deltoid will push it downward. So that's because of the attachment of the muscles. So remember the important muscular and ligamentous attachments to the clavicle.